And unfortunately, a lot of times the conversations are flipped where it's very transactional at the beginning. Can I get your name, your first name, your last name, your phone number, your email, your social security, your birth date, your blood type, whatever it might be. It's all happening at the beginning instead of at the end after you've gotten to know the person and why they actually called. And so she trademarked, or All-Star trademarked, the great call process, where we're working a patient or a team member through a system of how to build the relationship first, then get to know them, then ask for the appointment, and then get their information at the very end. And it's really, really successful. And so as a KPI, if you look at that way, a scorecard, if you will, there's different categories and things within each one of those steps. So GREAT stands for the greeting, the rapport, engage, ask for the appointment, and then take their information and thank them for calling. And so within each one of those categories, there's certain steps or different things that you are trying to make sure to accomplish. And so our members have the opportunity to have a call grade done each month where we access one of their calls and we just give them some feedback on how they're doing. So what's best is if the team is assessing themselves and they're saying, hey, office manager, doctor, this was a call that I feel like I really crushed it. I know I followed the great call process. Can we listen to it together and assess it? And this was one where I was challenged. I didn't know how to respond. Can we listen to it and see where I could have improved in that particular challenge that I had? And that's where we really want to get the team to be in that ownership mentality of their own skill set. And so this process helps to be able to strategize it and organize it.
I love that. I've not come across the great call process before. And so to hear how you break that down is really encouraging, because I do think it matters, especially as you think about first impressions. And so like you win or lose a potential patient in the first 10 seconds of a call, right? I mean, it's from that first welcome to how you make them feel. And I think the breakdown of what you just described with the acronym of GREAT is truly great, right? Or no pun intended, but it's like, it makes sense. And so do you have a way just to make this really applicable to everyone who's listening? Like, what does that sound like? If you could change one thing in the first 10 seconds that would dramatically improve that perception of the practice, what does that actually sound like if I were to be a caller?
Yeah. So if you called, I would say, thank you so much for calling. My name is Shelly. Who do I have the pleasure of speaking with? You'd say, my name is Chris. Great, Chris. Thank you so much for calling. May I ask what prompted you to call us today? Or so that I can best assist you, do you mind if I ask you some questions? And that's taking control of the conversation, but building a little bit of rapport right out the gate. And it's called our transition statement. So it's taking that initial question and converting it right over to being able to hear more about them. So for me, my go-to, and everybody, we're not a scripting company, but we give you like that great call acronym, and then we tell you what each of the pieces are, and then you make it your own. So a part of the transition for me was, what prompted you to call us today? Because a lot of times people will tell you their referral source. They'll tell you, I'm in pain. They'll tell you, I haven't been to the dentist in a long time. I just got insurance and now I can come. Well, they could have come before, but that's okay. So you're hearing a lot of the pieces that are going to direct the conversation so that you can build that rapport right out the gate. And I know, okay, this is a new patient. This is an existing patient. This is somebody who has a billing issue or needs to cancel an appointment. So I'm going to know that right away to take control of the call.
I love it.
Finding out their name, sharing your name, even if you said it in your greeting, I don't care. The number one what is it? How do they say it? The best word, the sweetest word that anybody could hear in any language is their own name. Yeah. And so knowing their name and using their name throughout the conversation and throwing it in there periodically, it's huge. It keeps them engaged in the conversation.
Does. Yeah, as a non-dentist calling in for myself, for my family, my kids, I can 100% resonate with that because I even in your explanation of that first 10 seconds, I felt brought in. I felt invited into what was taking place versus Chris, thanks for calling. What do you need? That type of thing. We're
First name, last name.
Yeah, like, okay, I made the CPR in my system. Check, 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 check. Okay, what can I do for you today? Right? Like it sounds overly simple, and yet it's so easy to miss. And I think by hammering down on those things and getting it right from the start makes all the difference. Two last questions that I think are really, really important for us, because one, I think for many dentists as the owner, but also for the front office teams, no one really wants to be felt like they're a salesperson. And you kind of got to this too earlier, right? It's like, well, they'll buy it or they'll accept the case or whatever it is. But reality is like, we are all salespeople, whether we want to or not, right? To sell is to humans. Daniel Pink, there's that book that says that. And it's so true. And so how do you communicate that to your front office of the importance of, the ownership piece of we do this together, but really like we want what's best for them. How do we communicate that in a way that's not salesy, but still gets them to do what needs to be done?
Exactly. So there is a big difference between pushy sales and supportive sales. And so what we're focused on is making sure that our teams are empowered and have the right tools to make sure that they're doing oh my gosh, get rid of that part. Good thing you can edit this, right, Chris?
That's right. No worries at all.
Okay, so great question. So what we do is there's a difference between pushy sales and supportive sales. And so we want to make sure that our team members have the tools and the communication skills to make sure that all of their conversations with their patients are supportive sales. If we know that a person came to our office because their overall concern is their overall health, if their concern is being able to eat the foods that they enjoy, if their concern is having a confident smile because they are out in the public and they want to have a beautiful smile, or their model or whatever, then we know that's important to them. If they just want out of pain or they want to stay out of pain, we want to know which thing is important to that patient, and then we can match up the conditions, what could happen if they don't do something, and how that impacts what it was that they came in to see us for in the first place. When you're doing that, it's a supportive sale. It's telling them, I know it's really important for you to not end up in dentures like your grandmother did. Because of what we're seeing today, this is what we're recommending. How do you feel about that? How do you feel about moving forward and getting that taken care of so that we can avoid where, you heading where your grandmother was? That's supportive. It's still a sale. It's still getting them to move forward, but it's different than, okay, we're recommending scaling and root planing and it's going to cost you $800. You want to do it? Like, totally different. Yeah. And so you have to know the patient in order to help make it a supportive sale. And that goes back to that initial phone call, knowing exactly who they are. And I mean, I use an analogy. If you were walking down the street and somebody said, you want a piece of gum, are you going to take that piece of gum? I hope that you're not going to take it, right? I've asked people questions before, and I had one doctor, he's like, yeah, I'd take it. I'm like, oh, don't take the gum from the complete stranger. But if you're sitting at a table with a friend and another person who happens to know your friend sits down at the same table and says, hey, would you like a piece of gum? You're more likely to take it. Consider that the front desk, the phone conversation, building just a little bit of rapport out of getting to know them. They're more willing to trust you, right? Yeah. Take it a step farther. You have a good friend, a family member. You're not waiting for them to ask you for the gum. You are going to say, hey, Chris, can I have a piece of that gum? That's where you want to get your patients too, where they trust you so much, they're asking for it. They're not having to be told you need this. Need is a 4-letter word. We try not to use that one in our case presentation. Yeah. They don't need it. Hopefully they want it. And that's where we really want to get them to. Yeah. Absolutely.
Yeah, it totally flips the script on how to enable a front office to have an effective sales mentality without having to feel like sales is a dirty word. So exactly. Yeah, I think it's a great presentation. One of the most important realizations that I think many of the practices that I talk to know that there's over 100,000 uninsured. Sorry, there's not over 100,000. There's over 100 million uninsured patients in America. And so knowing that when they call, there's already a reluctance to the fear of cost, the embarrassment of, well, I don't have insurance, and for whatever reason they feel guilty and shameful about it, right? And so that's naturally a conversation that the front office has to be prepared for, because that question is, well, what do I need to do if you don't take my insurance, and what options are there for me to still get service or get my, still get my treatment done, and what's that going to cost without it always being a barrier? So how do you think about that framework with your front office teams when there are solutions for those individuals to get their treatment done, but there's obviously some challenges to overcome?
Yeah. So we have a process. We listen, cushion, question. So you listen to the patient's concern, and then you cushion that and say, a lot of our patients don't have dental insurance. Do you mind if I ask you a couple of questions? Are you concerned about your overall cost, or are you more concerned about making sure that you're getting a value out of your appointments, or some sort of a question that's going to lead you to being able to talk about, hey, we have a membership plan, we have payment arrangements, we accept cash, check, credit, whatever. But rather than just jumping straight in and just saying, hey, I'm concerned about the cost. Okay, well, we have this, we have this, we have this, we have this. That comes across very pushy. So instead saying, I understand a lot of our patients actually are cash pay patients. They don't have dental insurance. Would you like to know how that works here in our office? Or would you like to hear about some of the options that we have here in our office? And that's opening the door in a gentle way to still do the same thing, right? It's not that people aren't having that conversation, but just transitioning it in a softer way where you're being supportive and caring and understanding about what they're saying, and using what we refer to as the law of the herd. It's not something we made up. It's out there. The law of the herd is basically making sure that they're not feeling alone. They're not feeling like I'm making a mistake by coming to your office because I don't have dental insurance, or I have to pay for this out of pocket. No, we have a lot of patients who are in that same boat. And the way that works here in our office is many of them sign up for our in-house membership plan. Have you ever heard of an in-house membership plan? No, I haven't. Oh gosh, would you like to know more? And then they can have the conversation about what that is that they have available in their office.